Good afternoon, folks. Now I'm going to discussion B for you. We are discussing cannabis has medical benefits, but the stories we aren't telling are putting people at risk. Okay, so here we go. The first time I saw cannabis truly help someone was a resident, a man in his 40s. Grant, nauseated, exhausted from chemotherapy. He sat on the edge of his hospital bed, apologizing for the smell. He had smoked a joint in the parking lot because nothing else touched the nausea. Then 10 minutes later, he was eating pudding and joking with the nurse. I remembered thinking, this is medicine, whether we admit it or not. Years later, I watched a teenager curled in a fetal position on an emergency department cot, vomiting into a basin every few minutes. He had been using high potency cannabis daily. His mother kept rubbing his back, whispering that she didn't understand. She thought cannabis was supposed to help with nausea. I remember thinking, this is harm, whether we admit it or not. These two patients live in my mind side by side. They are the reason I believe our national conversation about cannabis is dangerously incomplete. The benefits are real, but they live in specific stories. I've been I've seen cannabis help people in ways that feel almost malicious. A woman with multiple sclerosis who told me she could finally sleep through the night because her legs weren't spasming. A man with HIV who said cannabis saved or gave him back his appetite. And with it, his dignity. A child with catastrophic epilepsy whose seizures dropped from dozens dozens a day or a week to a handful a month after starting perfused CBD. These stories matter. They are the reason clinicians fought for medical cannabis. long before legislators did. They are the reason families advocate so fiercely. They are the reason we should never dismiss cannabis as furious or under uns, unserious, because these stories are specific, not universal. They are not the experience of every patient who walks into a dispensary. They are not the experience of every teenager who tries a vape pen. They are not the experience of every adult who uses cannabis to take the edge off. The medical benefits exist, but they live in narrow lanes, not broad highways. The risks are real, and they live in stories we rarely tell. Once cared for a college freshman who came to the hospital terrified because he couldn't tell what was real. He had been using high THC concentrates products that didn't exist in a generation ago. His psychosis resolved, but his fear lingered. He asked me if his brain would ever feel normal again. I've sat with patients who discovered their child's cannabis use only after a car crash. I've counseled pregnant patients who didn't know THC crosses the blood brain, crosses the placenta. I've treated adults who develop cannabis hyper hyper remnus syndrome and couldn't believe the substance they used to relax was now the thing making them violently ill. These stories rarely make the headlines. They don't fit the cultural narrative of cannabis as harmless, natural, or therapeutic, but they are happening every day in emergency rooms, psychiatric units, and primary care clinics across the country, and they are happening more often as products become more potent, more accessible, and more aggressively marked marketed. We have created an industry. We have not created a safety net. Legislation could have been a public health triumph. Instead, it became a commercial experiments. We have dispensaries with loyalty programs, but no potency caps. We have gummies shaped like candy, but no standardized warnings. We have high THC vapes sold in neon packaging, but no public health campaigns explaining the risks to developing brains. We have normalized cannabis without normalizing caution. When I talk to teenagers, they tell me cannabis is safer than alcohol. When I talk to parents, they tell me they thought edibles were mild. When I talk to patients, they tell me they assumed natural meant risk free. These misunderstandings are not their fault, they are ours. We can hold two truths at once. Cannabis can be medicine, cannabis can cause harm. Both statements are true, both deserve airtime, both should shape policy. The path forward is not prohibition, it is honesty, it is sense, it is public health messaging that treats cannabis with the seriousness it deserves. It is clinical training that helps providers recognize cannabis associated psychiatric symptoms early. It is regulation that acknowledges potency matters. It is education that speaks directly to adolescents, pregnant people, and families. Cannabis is here to stay. The question is whether we will keep pretending the story is simple or finally tell the whole truth. Cannabis has medical benefits, but the stories we whisper and the ones we ignore are putting people at risk. In medicine, certain moments stay with you the way scents do, sharp, lingering, impossible to forget. Remember the man in a chemotherapy ward, his hands trembling as he lifted a spoonful of pudding. Minutes earlier, he had been gray with nausea, unable to keep down even water. He had stepped outside, lit a joint, and returned with color in his cheeks. The nausea raised an eyebrow. He, he shrugged, embarrassed, but he ate, and for the first time in days, he smiled. The moment felt like sunlight breaking through cloud. And then there are the other moments, the ones that feel like a sudden drop in temperature. A teenager curled on an emergency department cot, reaching into retching into a basin, his skin clammy, his mother's hand hovering helplessly above his back. He whispered that he didn't understand. Why the thing that once calmed him now made him violently ill. His mother whispered that she didn't understand either. Outside the room, the hallway hummed with fluorescent lights, and the quiet chaos of triage inside everything felt small and fragile. These two scenes live in my memory like twin lanterns, one warm, one cold. Together they illuminate a truth we keep trying to simplify. Cannabis can heal, cannabis can harm, and our refusal to tell both stories is its own kind of danger. The benefits, small miracles in specific places. I've seen cannabis soften the edges of suffering in ways that feel almost tender. A woman with multiple sclerosis describing how her legs finally stopped their midnight choreography. A man with HIV who said cannabis returned his appetite, and with it, a sense of being anchored again in his own body. A child whose seizures, once relentless, eased after starting purified CBD, giving his parents the first quiet evenings they've they've had in years. These stories matter. They are the reason families advocate, the reason clinicians listen, the reasons lawmakers once stood in hospital rooms and promised change. But these stories are not universal. They are not the experience of every person who walks into a dispensary like a boutique. They are not the experience of every teenager who tries a vape pen behind a school. They are not the experience of every adult who retches for cannabis as a balm for stress. The benefits are real, but they live in narrow, carefully tended gardens, not in wild, unbounded fields. The risks, shadows we pretend not to see. Once I sat with a college freshman who could no longer tell what was real. His eyes darkened. His eyes darted around the room, searching for anchors that wouldn't stay still. He had been using high THC concentrate products as potent they would have been unmanageable in a generation ago. His psychosis lifted, but his fear remained like a bruise. I cared for pregnant patients who didn't know THC crossed the placenta. I've treated adults who's vomiting from cannabis hyperemnus syndrome left them dehydrated and bewildered. I've spoken with parents who learned about their child's cannabis use only after a car crash. These stories rarely appear in glossy advertisements or casual conversations. They don't fit the casual narrative of cannabis as gentle, natural, or harmless. Okay, guys, that is it for today. I will see about jumping on later for shows this evening. Until then, Gator Wellness, take care, folks.